What is a calcaneal spur? Most people think that this spur would cause pain. Now, does that look like it causes pain to you? It definitely does to me. A sharp spike in your soft tissue, but I'm going to show you how studies show that people with heel spurs but without plantar fascia pain do not have any pain in the morning. So you don't necessarily have to have someone come in and chop out your heel spur. You can be pain free without it. So, heel spur pain or calcaneal spur pain usually happens right there, right as you push on the center of your heel with your thumb. But for most people, in the more common area, if you bend your big toe back, your medial plantar fascia will become tight and you could feel it, and that's what's going to really be hurting. So, the heel spur is not something that develops itself and causes pain, but it's something that happens along with years of painful plantar fascia. As the plantar fascia, which is the ligament at the bottom of your foot that holds it together, pulls on the heel, over time, the bone gets ripped out, bleeds, adds a little bit of bone every day, every week, and then over decades, you develop this gigantic heel spur that extends into the muscles of the bottom of your foot. And this is the muscles that hold the foot together along with your plantar fascia. So, the plantar fascia, this is a ligament. Think of it as a thick old elastic that when you stretch, little cracks develop. Now, your body does its best to heal these little cracks through a process known as inflammation, but the body just never gets a chance to really catch up to the damage. And eventually, this leads to bleeding, heel spur formation, and chronic pain in the arch and heel of your foot. So it's not really the calcaneal heel spurs or the Achilles heel spurs in the back of your heel, which are also very possible with Achilles tendonitis, but it's these ligaments that are constantly pulling on the back of the heel bone. So the goal is to get these ligaments feeling better, and most people report that these heel spurs never bother them again. So, treatments that you can do, and I'm just going to briefly go over them here, that get you 50 to 60% success rates are stretching. This is the biggest thing you can do. But first, you have to decrease the pain. So ice the pain 3 times a day for 15 to 20 minutes. Freezing a bottle is great and rolling it under your foot. Massage the arch of your foot with a tennis ball, with a golf ball. These things all work great. You could even have your significant other do it. You can take oral anti-inflammatories or topical anti-inflammatories as recommended by your doctor. Different types for different people if you have heart or kidney problems. But then once the pain's gone over a week or two, stretching keeps it away. Stretching shows to be the most critical element of this treatment process. Then, people who are doing all these and are still not feeling 100% better, look into good shoe choices, good running shoes that support your arch. Get over the counter arch inserts. These things are getting phenomenal. Check with your podiatrist to get the right one, or your foot specialist. If that's still not working, a night splint, it's kind of a hassle to get and to wear, but the results are unbelievable. It's basically something that stretches your feet for you at night so your ligaments are nice and loose by the time you get up in the morning, and walking on them doesn't tear them apart. And then more stretching and different types of stretching. And if that's still not working, that remaining 10 to 15% of people, you could get a heel spur injection. This needle's not actually going in the right place, so it would be going into the heel. Or you could get casted for custom orthotics. These things are a step up from the over-the-counter. They're made sure to be molded right to your foot. And I'll tell you, I can't live without mine. If I take it off for a day, I start getting pain pretty quickly, and it reminds me of the life I had before them. And if that still doesn't work, the remaining 5 to 10% of people may need surgery because it could be a nerve impinged in the tissue, some scar tissue, things that can be cleared up by. Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.